Perfect. All right. Well, welcome to our Popular Pulmonary Wellness Chat and Chew. We love to have these little gatherings, and today we're going to be talking about coping with cough. So, welcome everyone. And before we get started, we like to start with a land acknowledgement. So, we are on the unceded ancestral territories of the Coast Salish people, and these are the lands of the Musqueam, Squamish, and Tsleil-Waututh nations. And if you'd like to share with us the lands on which you live, work, and play, please pop that into the chat. Just let us know where you are. It's always interesting to see where people are joining us from. And our chat and choose are a safe space. So we all join this conversation willingly with open hearts and open minds. And we want everyone to feel free to share their thoughts and values and opinions without fear of judgment and ask questions. So the information here is shared for educational purposes, and it does not substitute any professional medical advice from your healthcare provider. So, with that spirit in mind, we will get started. We do tend to get off topic from time to time, so you may notice that Jenna or myself kind of nudge the conversation back to the coping with cough topic so that we can move along and cover some of our education points and give everyone a chance to participate here. Um, so we'll end at our designated time in 1 hour. And then if you want to stay on afterwards, no problem, just for a few minutes. We have some other upcoming events. So we have the next Chat and Chew coming up on August 14th, also at 2 p.m. Pacific. And the topic for that one is summer travel, oxygen and energy on the road. So we know there's a lot of questions about that every year. All right, so get comfy. This is a chat and chew, so if you brought some healthy snacks or a glass of water, make sure you've got your comforts so we can settle in and start learning and sharing. All right, so we had some goals set out for today, and these are today's goals. So we wanted to understand the causes of cough and why people might be coughing chronically. We'll learn about mucus clearance and some breathing techniques that might help with reducing the amount of cough that you may have. We're going to talk about the emotional side of coughing because that can weigh heavily on us, especially if we're in public places and especially after the pandemic. People are a little more, excuse me, aware of that. And as we talk throughout this conversation, we're going to share some helpful and healthy habits to help cope with cough. And as we get started, maybe we can get a sense of who is joining us in this conversation today. So maybe with just a show of hands, we would like to know who here has been formally diagnosed with a chronic lung condition. So if you have a diagnosis of any chronic lung condition, just raise your hand. Yeah, Lisa can see. Keep it up there. We can, yeah, quite a few people. Oh, yeah. Are you calling Bob over to put his hand up there? Yeah, okay. Perfect. Welcome. All right, we've got a few more people coming in. Welcome, Maureen. Awesome. Welcome,
Yeah,
Dora.
we have Doreen, Jeannie, and Dora.
Oh, and Jeannie, great.
Sorry, I'm late. I was at another session that ran overtime. I just left early.
Thanks for making it, Jeannie. We appreciate that you bumped us up your priority list there. Thank you. Um, okay. And who in our crowd here uses regular mucus clearance techniques? If you have any mucus clearance strategies that you use on a regular basis, just put your hand up. Show of hands. Yeah, I am seeing hands.
Handful.
Okay, good. Some people have these good habits. Great. Okay. Last question. Has anyone been diagnosed with congestive heart failure? Do you have a diagnosis of congestive heart failure? No, shaking heads. No. Oh yeah,
No.
I think I see. Do I see one? No.
Your
Uh,
doctor might have asked you to maybe do some weight measurements or looking at swollen ankles, that type of thing. Anyone with that? Okay, great. That helps
I've
us.
had swollen ankles before for a short time with the pulmonary hypertension, but that's
Right.
not a major issue now.
Awesome.
Awesome
Thanks
to
for
hear.
sharing, Jeannie.
Yeah. Okay, we'll move on and we'll talk about the first goal for today, and that is getting a little bit of an understanding or an appreciation of why we cough. And so we all know that coughing to a certain degree is normal. So why do we do that? So coughing is a defense mechanism. So our lungs are a very fragile part of our bodies, actually. And they're at risk because they're exposed to the environment. So we pull the environment into our lungs and breathe it back out. And sometimes we might pull things that we don't want to have in our lungs. And so our upper airway can help us out a lot. All those little lovely hairs in our nose do actually serve a purpose. The mucus in our nose serves a purpose. It can trap some of those little tiny particles. And then of course, we have vocal cords and our upper airway, so we can close our vocal cords. And part of coughing is that we close our vocal cords, we bear down, we put pressure in our lungs, and then we open our vocal cords all of a sudden and we blast out a whole bunch of air. And that's where you get that hard percussive coughing sound, just that, and the air blasts out pretty fast, and it's quite effective to remove things that shouldn't be in our lungs. So, coughing is a wonderful defense mechanism. We have sensors in our lungs that will make us cough involuntarily if something hits those senses, like we might inhale a piece of, I don't know, dust, could be anything, and you just forces a cough. So, this cough as a defense mechanism is super important, but sometimes it's a little bit more than that. So, sometimes people cough for no apparent reason. We're not sure why they cough. And some people continue to cough regularly without seeing any maybe mucus come up, there's nothing in the air. And some people may be diagnosed with a formal diagnosis of chronic cough or chronic cough syndrome. So that in itself can be a formal diagnosis. By chance, does anybody here have a formal diagnosis of a chronic cough syndrome? This is different than having a chronic cough for another reason, but it is okay. So just want to make that distinction. So some people have that as its own disease process or its own condition. Usually, what we see more commonly than that is people who have been diagnosed with a chronic lung condition like COPD, asthma, interstitial lung disease, pulmonary fibrosis. All of these conditions can cause us to cough chronically. So there is a little difference there. And with the chronic lung conditions, we do see more mucus being generated. So sometimes we're just coughing because we have to clear the mucus out. Some chronic lung conditions have inflammation, and that can bother our lungs and irritate them, and make us cough as well. Also, with chronic lung conditions, our lungs are more sensitive to things that we breathe in. So we might find that we cough a lot more easily than other people we know who don't have a chronic lung condition. So it is a very common symptom of many chronic lung conditions. So if you're in the boat, probably we gotta raise our hands here if you've got a chronic lung condition and you do cough regularly. It's probably why you're coming to this session here. Yeah, okay, perfect. Yeah, yeah. So we do empathize um, with that for sure. And then having that cough, just coughing so often like that, it can be irritating. It can be exhausting. It can be so exhausting. It takes a lot of energy to generate one cough. So all of these coughs add up and they take our energy away. And then when we cough all the time, we don't really feel like going out in front of other people where we might be judged for that. And we don't want people to be afraid that we have something that's catchy. So sometimes to be considerate to other people, we tend maybe not to go out or we don't want to go into crowded places where we might make people a little conscious of us or we don't want to feel, judged. Yeah. Um, so when we're talking about cough, different people experience that differently. So if we'd like to, I'm going to stop the screen share for a second and we'll open the floor to a little bit of discussion. If you wanted to share with us, when is your cough at its worst? Is it related to times of day, like in the morning or evening, or maybe it's to do with weather or around eating? If anyone wants to share, please go ahead. You could pop it in the chat or just unmute yourself.
Yeah.
So for me, I have lung cancer and have had a lot of radiation treatments,
Ah,
and so what that has done has, I guess, it's created a lot of irritation, and so movement, getting up in the morning until everything kind of gets going are two of the biggest things for me.
yeah, yeah. In the morning can be quite common too. Do you find that you cough stuff up in the mornings when that happens?
Yeah, a little bit. Yeah.
Yeah, yeah. Okay. Jeannie.
I find that lately when I exert myself, I tend to cough more, and and then, like you say, I'm coughing for several minutes, and then I get really tired.
Yeah, yeah. That fatigue thing. Hey, it takes so much energy to generate one big cough, just one. Yep.
Uses a lot of our muscles. Sometimes we feel like the workout is the coughing itself.
Yeah.
Um, and the
It's
muscles
like
get tired and sore. Yeah.
Yeah, it's like the best sit up ever. But sometimes you might get soreness too. Does anyone get soreness in the ribs area and
Oh
the
yeah,
chest from
yeah,
coughing?
Yeah,
yes.
I think I
Yeah.
dislocated one rib,
Oh, ouch.
but there was other underlying factors with that. They did some surgery and they separated the rib, and now I can't get it back in. But
Oh, shoot.
Oh,
so the coughing is
sorry.
anytime I not sleeping, I could be coughing.
Okay.
It could be if I wake up during the night, the coughing can be pretty bad.
Yeah, it
Uh,
might wake you up in the night too, I
I
imagine.
can't cough while I'm asleep,
Oh, nice.
and
Nice.
when I'm busy doing stuff, like this morning, I was out picking raspberries and trimming the tomato plants. Everything fine. I sit down, stop moving, and the coughing just took over. And sometimes it goes on for what seems like forever, but be 2 or 3 minutes.
That's a long time.
Yeah.
Yeah, probably struggling to catch your breath in there.
Well, yeah. So, and they don't know what's the cause of any of the issues that I've got.
Mm-mm.
Okay.
It's
Yeah.
a hard one, Jim.
Yeah. Thank you for sharing. We also have some people sharing in the chat. So some people notice the coughing starts when they first go to bed, when they lay down. Um, and then also with eating or talking or drinking. So a lot of upper airway triggers there. Yes, more than one person with food and specifically certain types of food. So
Mm.
we're hearing about acidic food and spicy food, which does not surprise us too much, even with brushing teeth. So certain foods are known to make reflux worse, and a reflux can be a cause of cough because it's like acid that comes up into the back of your throat and it can trigger a cough. Yeah, that's rough.
Has anyone here been diagnosed with gastroesophageal reflux disease or is on treatment? Okay,
Uh,
a couple. Okay.
okay. Oh yeah, we've got cold air seems to cause coughing.
Yeah, that's with me.
Yeah. Yeah. Yeah.
It's really,
Lisa. Oh,
I don't know this house.
Yeah, you were just asking about the reflux and
Mm-hmm.
yeah.
the respirologist I saw, that was the very first thing he zeroed in on. And I have no awareness of having reflux. I don't use Tums or Rolaids. I have no feeling of heartburn. And he's like, forget all that asthma stuff. I'm putting you on proton pump inhibitors for 3 months to see if it helps. And it's been a month now, and I'm not noticing a lot of really any difference. So I don't
Not
know
improvement.
why he went there immediately, but
Yeah, we could speak to that a little bit. So,
this
when
was
it
like
comes
all the time, like that.
throat clearing, yeah. So when it comes to chronic cough, whether that's chronic cough related to your underlying lung condition or not, gastroesophageal reflux disease, or GERD for short, can trigger your underlying chronic lung condition to be worse, or can trigger symptoms like cough, like mucus, like throat clearing for some people. Um, and so if you have a high suspicion just based on things you're saying, like you've noticed patterns with the cough with food or with certain types of food, your healthcare provider, yeah, their mind's going to go there really quickly, especially with asthma, where we know that it can be close to up to 50% of people with diagnosed asthma having a comorbidity of GERD as well. Now, yes, to kind of tease out whether this is GERD or not, they will trial you on a proton pump inhibitor. So this is a tablet that you take daily to try and reduce the acid production in the stomach. Now, some of the key things with this is you do have to be pretty adherent to it. So you do have to try it every single day for that 3 months or so. But at the same time, you have to try and reduce the other causes of GERD, which is often the types of food that we're eating. And so for everyone, it's a little bit different, but it's all the most amazing things in life. It's the citrus, it's the alcohol, it's the coffee, it's the tea, it's the fried fatty foods. And from my experience working with clients with asthma that have GERD, for some people, it's one or two specific things. And so you might have to do a bit of trialing with food to kind of figure out what it is. And for some people, you have to cut it completely out. So a common example is coffee, which is high acidity, very common to cause reflux. And for some people, cutting down how much coffee you have, like a smaller cup or less in a day, might help. But for some people, you have to cut it completely out before you might notice the change. So in the chat, I'm going to post a GERD food trigger list, which has different foods. The ones in red will likely or very highly cause GERD. The ones in the yellow are a maybe, so you kind of can do some trialing, like cut it out for a period of time and see. And then the ones in green are okay to eat. And so, Lisa, that might help you out, especially because you haven't noticed a difference on the treatment alone.
Thank you, Jenna. Okay, and Jeannie, you're up next. Go for it.
I wanted to add a comment to the GERD discussion. I find that when I eat or drink or have any foods that have peppermint or menthol, they would trigger coughing for me, but I can have wintergreen and it works fine. So if I'm having like,
Interesting.
sometimes I like sucking on lozenges. So if I have wintergreen, I don't have any problems, but peppermint and menthol, like within seconds, I'll start coughing.
Wow, it's so good that you've narrowed that down and that you can still have something minty, but specific ones.
And
That's
then
awesome.
somebody else mentioned about when they're getting ready to lie down, like going from a vertical position to a reclining position.
Yeah.
That makes me cough as well. But for the GERD part of it, I sleep on a wedge pillow, so I can't lie completely flat. And I have to finish eating at least 2 hours before I make the choice to lie down. So I could be dead tired, but I still have to stay upright until my food is digested.
Right. Early meals before going to bed. Great tips, Jeannie. Thank you for that. Ellen, we got your hand up here too.
I think I think my question it has to do with the medicine, proton Nexium rather. Um, what is the best way to take it? Because you can read different things. The doctor says different things. I was curious, what's the usual recommendation?
So, they want you to take it before you eat food. If I recall, it's at least 30 minutes. So I find most people are taking it in the morning when they get up, and then just giving a little bit of time before you have your breakfast, maybe about 30 minutes or so. Um, you're in terms of any contraindications or anything to be careful of taking it with other medications and things like that, your pharmacist is definitely your most helpful person to kind of look at the medications that you're on, and just seeing if there's any recommendations that might help optimize that medication and keep, and certain medications need to be kept away from others. So they can be really helpful with that. Was there
I tend
anything else,
I tend to
Ellen?
take it before my biggest meal. My biggest meal is lunchtime, so I tend to take
Okay,
it before that, like up to an
okay,
hour beforehand.
okay. That seems fair from what I know about it. Yeah,
Okay, because I don't eat a very big breakfast, so it doesn't seem sensible
yeah,
to
yeah,
me to take it in the morning, just based on my experience. So
yeah.
that seems
And
reasonable.
it seems okay. I mean, because the other factor too is you want to remember to take it. You want to get into that habit. So if it's working out for you, you're in the rhythm of taking it an hour before your biggest meal. I think that that seems reasonable, and it's
Okay,
something
good.
that you remember to do every day. Yeah,
Oh yeah, I don't miss it.
perfect.
Thank you.
Thanks, Ellen, for that. Thank you, Jenna, for that. All right, I'm gonna go back to the screen share for a moment here. There we go. So we've talked a little bit about why we cough. So, and we've talked a lot about reflux. So that was great. Thanks everyone for that discussion. And some of the reason that we may cough is because of mucus. So that can be one of the big triggers, especially if you're living with a chronic lung condition that causes us to produce mucus, like asthma, like COPD, like yeah, emphysema, chronic bronchitis. And so, one thing that you can do for yourself to help get that mucus out, keep it nice and thin so that it's not, thick and difficult to move out,
Mm.
is staying hydrated and literally drinking lots of water or a sufficient amount of water is the recommendation. And you want to do that because it can thin the mucus, it makes it easier to come out, and mucus that stays in our lungs can become infected. This can be the source of getting pneumonia, getting a chest infection. and having an exacerbation or a flare-up of your breathing condition. So always make sure to drink plenty of water, although follow your physician or nurse practitioner's recommendations if you're on a water restriction. And then, Jonah, I will hand over to you if you'd like to talk about the active cycle of breathing. And I can go to the next slide when you let me know. But this is a technique that's, you want to pay attention to this one because this is a good one.
All right, yeah. So if you go to the next slide. So sometimes when you're reading about how best to clear the mucus from your lungs, you might hear about pursed-lipped breathing. And you might hear perhaps about some controlled coughing techniques. And these are techniques to help us to effectively clear the mucus instead of rolling us into that cycle of trying to cough and clear your mucus, and then you're coughing and coughing and coughing and coughing, and you're exhausted and you don't actually get a lot of mucus out. Is anyone having that experience currently where you feel like you get into a coughing cycle and you're just not, you just kind of get stuck in it? Yeah,
Yeah, I've got some nods
seeing
and
some
some,
nodding
yeah.
heads. Okay.
Yeah.
So the active cycle of breathing puts together three techniques in a continuum. So you see the arrows just kind of keep going around and around to help you bring up mucus from the lower airways in your lungs and eventually bring it up to where you can cough. Because usually the mucus needs to sit a little higher up in the upper chest for you to effectively cough it out. Now, some of you, your healthcare providers will recommend that you do mucus clearance daily as an everyday practice. Sometimes you might do mucus clearance and you feel like, well, I'm not coughing out much, but you might notice later in the day that you're coughing out more than maybe you normally would. So I just want to let you know that even if you're doing mucus clearance techniques, we do want that satisfaction of kind of getting that big piece of mucus out, but just know that the work that you're doing with your mucus clearance will continue to have effects during your day. And different things like hydration and movement will help you to get the mucus out in addition to this technique that I'm about to walk. So one thing to keep in mind when we want to do mucus clearance is we want the airways in our lungs to be open. And I'm just, Tina, if you wouldn't mind stopping the screen share just for a moment. I'm just going to give us a frame of reference. So if you look at these bottle airways, so these are airways in our lungs that branch all throughout our lung like a tree root. They're a little bigger near the tops of our lungs and they get smaller the further they branch down. So for many of you with a chronic lung condition that affects your airways, such as asthma or COPD, what's happening, or the visual to keep in mind, is you've got perhaps some inflammation in the airway and perhaps some excess mucus production. And then the muscles around the airway, instead of being nice and relaxed, thanks, Tina, they can get really tight. So you can see how an airway that should be nice and open and really easy to clear mucus as our natural defense mechanism can now start to get a little hard. So we've got swelling making that airway smaller, excess mucus production, maybe even plugging certain airways, and we've got tight muscles around the airway. So something like this, we've got to work at it to help open the airway and get that mucus moving through, moving up our airways all the way to the point where we can cough it out. So just a thumbs up if you're following so far and if that's kind of making sense. Okay, awesome. So then if we go back to our cycle, great. So if we go back to our cycle and we start at the top at controlled breathing, This is when we are sitting upright. So all mucus clearance techniques should be upright as opposed to lying down. We're in a relaxed position. So a relaxed position means that we're dropping our shoulders low. We're relaxing our upper airway, our arms. We're relaxing in our neck because we don't want those muscles that are going to help us to cough to be tight and engaged because of stress. We want everything to release down and be working to get our cough out. So we can start with something called pursed-lipped breathing to help us through. So once our resting position is there, shoulders down, arms relaxed, neck relaxed, we can start to breathe in through our nose and out through our mouth through pursed lips, almost like we're going to whistle. It's almost like a drawstring on a bag, and you kind of tighten that drawstring. It's almost like we're doing that with our lips. So why do we do this? Well, we do it for a lot of reasons, but the main reason is to create a little back pressure in that airway. So we're breathing through resistance in our lips, and that means we create a little pressure in our airways that will hopefully help to stent or kind of open these narrow blocked airways. And if we can stent or open blocked airways, we can get air behind the mucus, and that will allow the air to help push that mucus out eventually. So there's no rhyme or reason how long you stay in controlled pursed lip breathing. You can find your own rhythm. Maybe it's a couple minutes, maybe it's 10 breaths of pursed lip breathing, but you really want to get into a nice, relaxed rhythm of breath. Thumbs up again if that seems okay. Okay. Next, what we want to do when we're doing this mucus clearance technique is we want to then add some deeper breaths. So for those of you that are familiar with breathing techniques, this is sort of your belly breathing or your diaphragmatic breathing. We're engaging the diaphragm to take bigger breaths, really filling up the chest cavity with air and releasing. And the goal here is to get air further down the airways in behind more of this mucus in a controlled way. So we start to do some deeper breaths. For those of you belly breathing or diaphragmatic breathing, sometimes it helps to cue us by putting hand on chest, hand on our abdomen, connecting with that diaphragm, that big breathing muscle. And as we take the deeper breath in, the lower hand will push out, and then the lower hand will release as you exhale. So maybe we want to try that now as we're all together practicing here. So one hand on upper chest, one hand on abdomen. The goal is the hand on the upper chest should remain pretty steady, whereas the hand on the lower abdomen is going to start to move in and out with our breath. So here we go. We're going to inhale. Lower hand moves out. We're going to exhale through those pursed lips. Lower hand moves in. Inhale. Exhale. Good. And we're going to keep going like this for 3 to 4 breaths. Really feeling like the air is getting down deeper into the chest. And when we've done those deeper breaths, we can go back to pursed lip breathing. Amazing. Awesome. How did that feel? Okay. Good. We get the bonus of this technique also being very relaxing. So you get a bit of relaxation in with your mucus clearance. All right, so then if we look at our cycle here, we go through that a couple times. Pursed-lipped controlled breathing, a series of 3 to 4 deeper breaths, coming back to pursed-lipped controlled breathing, going into deeper controlled breaths. And so we can do that maybe for a period of 10 minutes or so, or until you feel like you are ready to cough. Okay, so we're going to keep our cough until we feel pretty ready to cough, or until we've hit about 10 minutes, because we don't want to completely tucker ourselves out with an active cycle of breathing. It is some work. We are using our muscles. So we're going to give it just a max of 10 minutes or so. Now, when you're ready to cough, we recommend something called a huff cough. Has anyone heard of a huff cough before? Seen some
Yeah,
nodding
I've
heads.
seen. Yeah, a little
So a
bit.
huff cough is a gentler cough. It is a type of cough that we can use to help prevent us getting into that uncontrolled cough where we just keep coughing with, and it's quite uncomfortable. It's a cough that comes from the back of the throat. You're opening your vocal cords. So as you take that big breath in, you open your vocal cords, and then you let out air very quickly from the back of your throat, keeping your vocal cords open. And what this most mimics in our everyday life is almost like if you're going to fog a mirror or a window, like a. So my vocal cords didn't close to get that harsh C cough, but my vocal cords were open and air was moving out very quickly. And I'm actually going to do that 3 times in a row when I'm ready to cough. So I'm going to take my big breath in, and then I'm going to huff 3 times in a row. And I also feel this down here with my diaphragm. So as I huff, I'm feeling my diaphragm tightening to expel the air. So if I had my hands here, I would feel myself breathe in, and I would feel my muscles contract to be able to huff that air out. And hopefully with that air comes the mucus. So we always want our tissues handy when we huff cough. And as respiratory therapists, we always encourage you to cough into your tissue and take a look at your mucus, because your mucus gives you a lot of information that you can pass on to your healthcare providers. So we want you to take a look at it and kind of see what's the color. Is it thick? Is it thin? Is it clear? Is it sticky? Whatever words you want to use for it, capture that in your mind or even write it down in a journal, because that can give your healthcare providers a lot of information to work with. Okay. Now, if we come back to the cycle and also this beautiful setting on the
Yeah, that's
screen.
weird. Where did that's my, I know. There.
There we
Did it
go.
switch?
It did.
That was
Yeah.
beautiful, Pender Island, BC.
Pender Island. Gorgeous. So my key message for you, I think there's a lot of important things here, but the key message is remember the cycle doesn't stop with your huff cough. After you cough and you look at the mucus, go back to your pursed-lipped controlled breathing. So for some of you, because of your underlying lung condition, you have a lot of irritation there. And that fast air moving through to get the mucus out can cause irritation in and of itself. So the way that we're going to calm that irritation, prevent us getting into uncontrolled coughing, is to come back to the pursed lip breathing, that slow breath in through your nose, out through those pursed lips, and then carry on in the cycle. Again, you might carry on in the cycle if you feel like you have more mucus to clear, or if you're not quite at your 10 minutes and you kind of want to give it a little more time to see if you get more out. But again, do give yourself about a 10-minute time limit so you don't tucker yourself out too much. So any questions with active
Amazing.
cycle of breathing? Is there anyone
Awesome.
that's using this already?
Oh yeah, a little bit. Not too
A little
many.
Yes.
bit?
Little subtle nods. Yeah.
Yes.
Some nods. Good.
And
And
it's helping.
how
It's
are you finding it? Do you find it effective?
very effective. Yeah,
Awesome.
it's helping me.
Good,
Thank you.
good.
Yeah.
Yeah, yeah, awesome. Um, before we start talking about the emotional toll of coughing, let's just stick with our some coughing techniques. Does anybody want to share any strategies or techniques that have worked for them? Sometimes we find that people have figured things out on their own and find new and different ways to help control cough, to help clear mucus. And lead to easier breathing. Does anyone have anything they wanted to share? Oh, yeah, Bobby, go for it. Oh, what? Oh, there you go. Okay.
Lip breathing is an excellent tool. And if I'm going for a walk and all of a sudden I find I'm walking too fast, I'm getting out of breath, straight away I use my pursed lip breathing and it comes back into control, and I can continue to walk. Not as fast as I was, but I continue to walk. So
Awesome.
I use it every day. I use it all the time. I use it sometimes I don't have to wear my oxygen when I'm sitting down. So a lot of times at night, or if I'm at some place like church or something, I'll have it off and I'll forget to put it on in time by the time I do something. So then right away I'll start first the cough, breathing, and that'll stop my cough enough that I can get a cup of, drink water and get that over it. Sometimes I don't get it. Sometimes I don't make it. But yeah, anyway, that's what happens. Thanks.
Awesome. That's great. Yeah, it's a super good technique and it's always nice to hear when it works. Jeannie.
I find that with exertion, that if I exhale with pursed lips on exertion, it could be climbing stairs or singing or talking on the telephone, that it does help. And also when I need to take a breath, one of a speech and language therapist taught me about 10 years ago that when I need to take a breath, to close my mouth momentarily, even when I'm talking. Now that I've mentioned it, you'll probably be watching me, but I try to, remember to not, leave my mouth open and catch a mouth breath, but to breathe nasally. And that has helped me greatly over the years.
Awesome. That is a really good tip. So remember, I was mentioning all these things that our nose does for us. If we breathe in through our mouth, it can bypass the nose and we don't get those benefits. So one of the benefits, or two of the benefits that I didn't mention about the nose is that it humidifies the air and it warms the air. So just that the air passes through your nose before it hits your lungs, it becomes body temperature and very close to 100% humidity. So it's preparing us to do some gas exchange, but it also makes it nicer to breathe in and less likely to trigger that cough reflex. So some people mentioned that cold weather can trigger the cough reflex. So definitely breathing through your nose can help when it's cold weather. Or sometimes just putting a scarf so that when you exhale, there's like a little space of warm and moist air so that your next breath in is a little more conditioned already before it goes to your lungs. And you might find that that helps reduce your cough in the cold weather. Oh, yeah, Bobby, have you tried that? Yeah, okay. Yeah, a scarf, a mask. Yeah, something there, something that's not dusty. A new scarf. Clean. Awesome. All right, we've got about 10 minutes left. If we're ready to go on to the emotional impact of coughing. We saved the best for last here. See if I can. There we go. All right, the emotional impact of coughing. We really wanted to bring this up because this can be one of the bigger things to deal with sometimes. Maybe, the cough is annoying and whatnot, but really that social stigma, it can be so isolating and lead to some awkward conversations um, where we want to empower you to stand up for yourself, speak up for yourself, and advocate for yourself and other people with chronic lung conditions who do cough regularly, who are not contagious. It's actually safe for other people to be around. They're not going to get sick because a cough in itself is not contagious, only if there's some sort of infection. So we all know that COVID made this a little more challenging, right? People are aware, they're cough aware, where formerly they maybe were not. Um, so here are some tips about um, trying to reduce cough a little bit. So sometimes coughing can have an emotional aspect to it. I don't want to say like entirely that's the cause, but sometimes that might be what triggers it. So if we're in a situation where we get a little bit panicky, like shortness of breath, we know we've got to do something active that can cause us to be short of breath, that might actually induce a cough. So this is where the tip stay calm comes from. And certainly that pursed lip breathing, like you were saying, Bobby, not only does it help increase oxygen levels and can just being in control of your breathing can help you control the coughing as well. But it also sends some feedback mechanisms to our brain for us to calm. So instead of going in that fight or flight response, we're going into that parasympathetic nervous system of inducing a state of calm. So pursed lip breathing can really help with that. Breathing in through the nose, out through pursed lips. Carrying water or cough drops, again, that's come up in our conversation already. Sometimes a sip of water can help calm the cough. Cough drops might be easier to carry, or lozenges, or specific mint candies. And then don't be afraid to just tell people, hey, I cough because I have whatever lung condition it is. And you know what? It's not contagious. You can't catch it. This is normal for me, and I can't control it. Right? So that could be awkward. Would anybody like to share any experiences about coughing where you may have felt awkward about it or didn't want to go somewhere because of coughing? We know it can be quite isolating.
I have found my husband and I still wear masks when we go indoors.
Yep.
And that's pretty rare now where we live. I think it probably is in a lot of places, but we're in a smaller community, and it just seems like everybody's forgotten about the pandemic and any kind of good hygiene measures that we learned during the pandemic that were actually a benefit from it. So what I find really difficult is getting the dirty looks or the irritated looks from people because you're wearing a mask coming in the store. So sometimes I kind of go back and forth a bit between sometimes feeling like it's nobody's business what is going on in my life. Why should I have to explain why I'm wearing this mask? But then other times, I do, as you said, and I think that's really good, that the point about the simple explanations is that I tell people, I'm not sick, but I have close family members who have a chronic health condition that's serious. and I'm wearing this to protect them. And then they usually kind of, okay, oh, well, all right.
Yeah.
But yeah, I just think it's really unfortunate that, you know, either way, I guess that we have to explain ourselves, whether it's explaining, you know, why someone is coughing because they've got just a chronic condition that they have to explain themselves now to people, or on the other hand, explaining why you're wearing a mask, that you're doing that to protect yourself from getting sick so that you don't pass it on to your loved ones. So
Yeah.
it's more of a comment, I guess.
Yeah. It's fair. I think a lot of people go through that. Jenna, you got a comment on that?
Yeah, I love that you brought that up, Lynn, because I was going to bring up masks as well. And I think it is just about coming at it from a sense of education. So to other people, just in a calm and informative way. So the way that I use masks, Tina and I have both shared that we have asthma, and after an asthma flare up, and I'm getting back to skating, which is my exercise activity that I enjoy doing, but is harder to get back to it after an exacerbation. That's when I feel like I'm coughing more because the cold air triggers me. And then at the same time, I'm like, for my emotional well-being and exercise, I want to get back to skating. But I learned in the pandemic that wearing a mask helps for the reasons that Tina explained. I'm in cold air, so the mask is on. I'm breathing humidified air that's warmer, and pandemic showed me that it really helped me. So I just continue to do that. And then my fellow skaters will be like, "Oh, are you sick? Like, why are you wearing a mask?" I have asthma. I'm just getting over being unwell. This helps me get back to skating. And they're like, okay. And yeah, it feels like I don't want to have to say that every time. But, you know, once you give the simple explanation, they're like, okay. And off we go. We're on with whatever we're doing. But I do think you're right. I think we did learn a lot from the use of masks during the pandemic. And for each person, you kind of figure out whether that helps you or not in your particular situation. Yeah.
Yeah. I think part of it too is trying to calm that inner dialogue that we end up having with ourselves about these situations that are causing emotional angst or frustration or exhaustion, whatever it is. Bobby, you've got something to say on that.
Say I have asthma as well as COPD. So whenever I'm with anybody and I have to cough, which now that I'm on oxygen, it's very rare when I'm on my oxygen. And they just said, "Oh, she's okay. She's got asthma." My friends and my family say that, so I feel good, you know, about that. But yeah, I try to control my breathing when I know that I'm getting into a situation that I might start coughing. I try to head it off the path, I guess you could say.
Yeah. Yeah, it's exhausting that inner dialogue where yeah, I totally relate. Yeah, but you know, you got to protect yourself. You've got to protect your family. If you need to wear a mask, if you decide to wear a mask, just feel empowered. You know, there's big groups of us out there that are not thinking weird things about you. We support it and we're wearing our own masks from time to time as well. So, you know, don't feel alone in that, although even in the moment we know it's a challenge, but know that you've got a big group behind you for sure. We're there. Yeah. Yeah. Sending out the love with the mask wearing. There we go. Got it. Awesome. We've hit our timeline, so we will work towards wrapping this up. I can't thank you all enough for sharing. We will leave you with these 4 amazing tips to keep your lungs healthy in general, but also to help reduce cough. So use the inhalers that you've been prescribed and use them consistently. The picture I got is the blue one. It's probably not the blue one you should be using regularly. I'll point that out. Um, Vaccinations, get them and get them when you're scheduled to get them. It does help. It reduces exacerbations, flare-ups. It is one of the things you can do that is proactive to keep yourself healthy and people around you healthy. Avoid your triggers, whether that's food, certain foods, smoke, dust, um, what do you call it? Forest fire smoke, cold air, whatever that is. Ask your healthcare professionals about it. Ask us about it. We've got tips to help you avoid triggers once you identify them, and we can help you identify them too, and then finding ways to mitigate that. And then gentle activity helps loosen mucus. It did come up. I think, Jenna, you had mentioned it. But yes, activity and exercise can help loosen mucus and get it up and out. So keep moving. It's better for you in so many different ways. Mental health is part of that too. So we'd like to thank you all for joining our chat and chew today, and thank you for sharing your experiences and your tips and tricks with us. Um, we will stop our Zoom recording in a moment here, but if you'd like to type in the chat, one thing that you will take away from this session, if you'd like to just shout it out now, please go for it. Jen, I'll let you read if there's
Be
anything else.
proactive and take care of ourselves.
Awesome. And how about that active cycle of breathing? That's my favorite
Amazing. Yeah,
part.
active cycle of breathing.
Yeah.
So just before you all go, actually, I am having trouble uploading my GERD trigger food list for
Okay.
you. So those that are interested in getting that list, if you wouldn't mind just hanging on at the end and I will email it. Zoom is blocking me uploading it for some reason. I'm not sure. So hang on at the end if you'd like that list.
Thank you. And if you're looking for more, we have a coping with cough blog post. Oh, Jenna, are you able to pop that in the chat
Yes. Yep.
discussion? The link is in the slideshow. And then our next chat and chew session, as a reminder, coming up next month, August 14th, 2 p.m. Pacific. We're talking about energy and oxygen on the road, summer travel, although you'll find it'll apply any time of year. And if you're looking for more, we have our online community. Give us a shout at this number here, 236-361-3480, and you can book your free 15-minute welcome session where we can get to know you a little bit and show you around our community and let you know about some of our offerings to help you get out there and live your best long life.